This is a Power 98.7 podcast. Now we're talking. Subscribe to Power 98.7 podcasts in iTunes or wherever you get your podcasts. There's more on power987.co.za. Tech Tuesday. Absolutely. It's about 9 minutes after 2 o'clock and we are on air on Power 98.7. And this is some people's favorite conversation to have here on Power Lunch, all about tech. And today we're talking about access to healthcare, which of course remains a critical issue in South Africa, particularly for vulnerable communities that are burdened with poor infrastructure and limited resources. With the majority of the population reliant on public healthcare, there's an urgent need for innovative solutions to improve access and quality. Now, the advancement of healthcare technology, particularly through platforms like Phylaxis.ai, or maybe it's .ai, present a very groundbreaking opportunity to bridge these gaps by leveraging data science and AI. Phylaxis.ai offers a personalized approach to health that empowers individuals to take control of their well-being. So that's what we're discussing today, how Phylaxis.ai is playing a transformative role in addressing these challenges, particularly in underserved communities. We're joined by entrepreneur, CEO, and angel investor and philanthropist, Lovkesh Arora. Thank you very much for joining us.
Yeah, good afternoon, Pabi, and good afternoon to the listeners of Power FM as well.
I mean, I should know better. I've learned that with tech names, you mention all the dots, all the hashtags, all of the elements. And this is a very important set of data that you collect and use, and the leveraging of AI as well. So perhaps you can share with us how you define vulnerable communities and what makes healthcare access such a critical issue for these groups.
Yeah. So, vulnerable communities are groups of people who are more likely to experience poor health. And certain factors that mainly affect this are your social, economic, environmental, and to certain extent geographical as well. So, these groups contribute to the larger part of the access to the healthcare, and especially in the public healthcare sector. And the challenges or the agendas which needs to be addressed specifically for these groups, we define that in three points, which are, first one is your inadequate access, which means like how do we make healthcare services accessible to everyone? The second one is limited resources. So that's a challenge. And the agenda becomes as like, how do we improve efficiency and bring intelligence as well, that we can do more with the limited resources. And the third one comes as inequality in the quality of healthcare. And that's an important point to be addressed, is that like, can we get the same quality of service to the rural areas, what we usually get in urban areas over here.
Yes.
So that's how we perceive this, and our entire approach is grounded onto this.
Tell me a little bit about the research or data that you've used to base your understanding of the healthcare disparities in South Africa, in vulnerable areas, and how has that then shaped your approach to solving these issues?
Yeah. So this is one of the sector wherein not many researches have happened, but there are few available, and the evidences have also been collected on this. Mm-hmm. And one such paper, which is in a public domain, published from one of the recognized university in South Africa. So the name of the paper is Perceived Unmet Needs in Healthcare as Inequality Indicators. Now, the paper has evidence on these three challenges that we just discussed, which are inadequate access, limited resources, inequality in the quality of healthcare.
Yeah.
So the paper does talk about, they collected the data, they understood, and So now with those evidences, firms are thinking around those three challenges, that how those to be addressed. And then the agenda of Phylaxis.ai is to promote better health and well-being for everyone and reduce national disease burden and associated cost. Now, this agenda is only possible if we solve the three challenges which we just discussed. So that becomes a foundational to our approach in terms of what we're trying to do.
I'm very surprised when you say that not that much research has been done, because this is such a rampant and often spoken about issue in South Africa. What are your thoughts about that?
Yeah, so see, research is an expensive affair as well, and specifically in this context of the 80% of the population which access the public health care, and such a diverse settings from a socio-economic, geographical aspect, and covering that from a wider aspect. So it takes a lot of resources. So I'm grateful that some research has happened. And so that itself is good enough and valuable for the people like us to be considerate of and think like what can be done to address those challenges.
The number to dial is 0861 987 000. We've spoken often about the healthcare challenges that we face as a country. We've spoken a little bit on Tech Tuesday about the brand new innovations in tech when it comes to healthcare, but bridging both of them is what our conversation is about today with the entrepreneur, CEO, and angel investor and philanthropist Lovkesh Arora, here to tell us about the platform Phylaxis.ai. Let's talk about the collaboration between governmental and non-governmental organizations and how important it is for collaboration in order to address healthcare disparities.
Yeah, so healthcare is an area wherein a lot of various different aspects to be considered when we're looking at achieving a better health, well-being, and I'll specifically talk about the aspects of like how do we do a case detection. How do we connect to care? Then how do we ensure adherence to the treatment? And then the most important point, which is in a talk since COVID and is being advocated by the world authorities as well, is that how do we ensure or provision large-scale preventative healthcare into the country? So now, there are various aspects to be covered in a geography like this. So, with the limited resources across, so that's where the need of the NGOs and the collaboration comes in. And wherein, to give you an example of if in a certain region, government is fully equipped to support the case detection and connecting to care and treatment, then NGO can play a role of maybe promoting a preventative healthcare services or promoting onto the health literacy aspects, which helps in early detections. So that's where we'll see as a comprehensive approach and coming with all the players together. And that kind of a collaboration do exist in many parts of the country as well as in the world as well, and which is more effective also.
Right. In your opinion, what are some of the most pressing challenges of the vulnerable communities that you're trying to alleviate?
So as I mentioned, your inadequate access. So basically, agenda is like how do you get all these quality healthcare services accessible to everyone? And the second aspect that comes is we have a limited resources, and that is going to be the case all the time. And we understand even from the healthcare task force or even the equipments which are needed to provision the services at the scale for any country. So it's always going to be limited. Then the question comes is there a way that we can bring in some more of a intelligence and efficiency and effectiveness into the approach, which gives us more of a targeted interventions,
Right.
high yield interventions, and so that's where we think that these are the areas when we look at more from a data driven approach, and that's where we will get into the more depth of the platform, that
Yes.
how are we getting into that. So yeah.
And I'd love to know more about that. I think it's important to just understand the lay of the land first. And I know you're here in South Africa, but how far-reaching globally has this Phylaxis.ai been so far?
Yeah. So just as a bit of a background of this, so Phylaxis, it's a medical word that stands for protection against infection. And that's where the Phylaxis.ai comes in. And the core construct of the platform is that how do we effectively combine the established medical science and the evolving data science and AI to promote better health, better well-being, personalized, prospective, preventative. How do we bring more targeted interventions, targeted approach, high-yield interventions, and the important part is that for any meaningful large-scale impact, the thinking has to be that how do you bring all the various different stakeholders of the healthcare together to play their part.
Yes.
And that's what we describe, that yes, everyone has a role to play if you want to make a national level impact, which in this case, our vision is that how do we contribute to reduction in the national disease burden and the associated costs. Now, all stakeholders need to come together. When I say that as an individual has a responsibility to play. As an institution, be it a government, be it an NGO, or be it a private sector, they have a responsibility to play in this. Then we talk about pharmaceutical, health product companies, they have a responsibility to play. Then we talk about the innovators. They have a responsibility to play, is that how, what more can they bring in existence in terms of bridging these gaps. So that our role comes is that how do we bring all these players together?
Right.
Okay, so that's why we're using a term saying that everyone has a role to play, and we have created a reasons for them to come together.
Yes.
Which is precisely around driving around the data. And largely, if you look at the behavioral data, the symptomatic data, the risk profiling, the literacy aspects of the population, this kind of a data does not exist at scale in any part of the world. And so that's where we coming into play with Phylaxis.ai, is that how can we create an impact in terms of case detection, connecting to care, then the treatment, and then moving towards onto the prevention.
Yes.
With an approach of a data around that.
I mean, on that point, and maybe I can ask you here, I mean, earlier you talked about how this platform also assists with adherence to treatment, which I thought was quite interesting. Sometimes the biggest critique is that perhaps medicines will be dispensed, but we're not sure what happens at home as healthcare providers. And so how do you assist people to adhere to their regimes?
Yeah, so adherence is a difficult subject, and a lot of experiments are happening. So one small example, adherence is mainly from a behavioral aspect,
Right.
and that is one of the core thing that we're trying to address from a platform. because there's not much data exists based on that, if anyone can say that why people do not adhere to the treatment. Now the question comes is, there's one way is that you can go ahead and start collecting a data to understand why people don't do that.
Yes.
Or there could be an approach is that you can try motivating people to adhere. Or the third thing is that you can create some creative solutions wherein adherence comes naturally, but then all other aspects also come together. So which means I'm saying is that in a one shot, are we able to motivate individuals to stay to the treatment, and then slowly this motivation as keep going becomes a behavior.
Yes.
And it becomes a habit as part of a routine. So those are the elements which have been built into the platform. In certain context, so we have a full-fledged rewards mechanism into this, and so which plays a role not only onto the adherence but onto your prevention aspect as well, because when we're looking at a reduction in disease burden, so while we are giving treatments to the ones who are needed, at the same time efforts also required so that people remain not sick. So they remain well. So how do we ensure that? So that's also one of the elements which is more of a behavioral aspect. So we leveraging that aspect of rewards. And specifically on the rewards, I would just want to emphasize is that having a rewards program for a platform at a national level, it requires a fundamental different thinking that how this will sustain. And we have those elements into the platform.
So I imagine then R&D or research and development is important in coming into this space and in driving innovation. Can you talk to us about some of the steps that were taken?
Yeah, so I can give you one classic example from where we started. And before I get to that, so we are one of the organization who have pioneered the development of a HIV risk prediction model. So we were the first one to embark on that, and so we had 3 research papers published as well on this. So this journey started almost 4 years back, and
did you say 4?
4 years back, and so the questions were around is that like how do we contribute to the metrics on 90-90-90 or 95-95-95 now from HIV perspective, is that how many people should be know their status and putting onto the treatment. So that's a metrics that World Health Organization is pushing, and the countries are also pushing in terms of achieving that. So the perspectives were is like how can we contribute to that? So yes, we started with an agenda wherein thought of like how technology can play a role, specifically in case of this when there are a lot of stigmas attached to HIV, and when the question comes is like 95% of the people should know their status, but the key question at that time was is that but we don't know who are those people who don't know their status. Then how do we reach? So what approaches can we take which are more cost effective and accessible and acceptable as well?
Right.
So those were the same principles that we just spoke on the challenges aspect as well. So which we started thinking on that, and then we followed the same approach of the data collection, the clinical trials, and with the researchers involved, and then came up with a predictive model, which if someone goes through that, it gives a relatively risk profile of an individual, and that becomes a data point for a targeted intervention, targeted approach. And to give you an example of like if we run this module well in a particular region, we will be able to differentiate what resources to be shipped to KZN as compared to Western Cape. What medications should be pushed into a particular province as compared to the other one. Where should the camps be initiated in terms of doing the HIV testing rather than just going everywhere.
Yes.
So as I mentioned, resources are always going to be limited, but then how do we bring that intelligence with us, which does not exist to that extent as of now, because the risk profiling and the behavioral aspects have not been captured over a period of time. And similarly, like the belief system and the behavioral aspects in a region could be different than the other region. That does say that, yes, your interventions should be customized and tailored to that. So
I'm thinking that as well, Lovkesh, because I think campaigns do exist and interventions do exist, but perhaps they're too broad and aren't specified to the different regions.
Yeah, so I can pick up another example on that, which is currently the public campaign on the breast cancer, which is currently live as well in the country, and anyone in the country can have access to that. That's a classic example of a NGO playing that role.
Right.
So I can name, it's a Breast Health Foundation with whom we have collaborated. And this initiative is funded by Novartis. So they picked up this program as one of the innovative program from the last year for their EPIS program. And so with the collaboration of Breast Health Foundation, so we were able to launch this last year for everyone in South Africa to make use of this. And this module precisely is targeted about early detection and prevention. And the core thing that we are addressing and trying to understand is also on the health literacy. Now, certain diseases, there's not enough data to do a predictive modeling.
Right.
But then from a medical science perspective, we thought to what extent we can make use of technology and still an effectiveness can come out, which I'll just describe what that is. And that goes into the targeted approaches. So this,
hold on to that thought, because we're going to find out what's happening in our 2:30 Power headlines.
Sure.
And I think this is where we'll start pivoting into describing the actual technology, how it works, and a better description of exactly what Phylaxis.ai offers. We're in studio with entrepreneur, CEO, angel investor, and philanthropist Lovkesh Arora, talking about tech for health, revolutionizing healthcare access in vulnerable communities. It's just after 2:30 here on Power Lunch.
Speak up. Call the Power Line on 0861 987 000.
Yeah, an absolutely riveting conversation here on Tech Tuesday on Power Lunch. Welcome to the afternoon. My name is Pabi Moloi. We're sitting with entrepreneur, CEO, angel investor, and philanthropist Lovkesh Arora, who's talking to us about healthcare and, in particular, the data science and AI behind the platform Phylaxis.ai, which offers a personalized approach to health that empowers individuals to take care of their well-being. But overall, it's about how technology and innovation work in the healthcare space and can solve a lot of our issues globally. If you'd like to run a question by Lovkesh, or if you'd like to have your own comment, please give us a call on 0861987000. You can also WhatsApp us on 0833037093. So earlier I had asked Lovkesh about where else in the world this has been used.
Yeah.
And of course, with your accent, I had to ask you where you originally were from. Tell me a little bit about that story and that journey. This is an Indo-Africa innovation.
Yeah. So I forgot to mention earlier, sorry about that. It's an initiative which I call it as an Indo-African construct, because the team of medical practitioners, scientists, software engineer, data scientists from South Africa and India have collaborated together for almost last 3.5 years. And that's where Phylaxis.ai comes into existence. And our approach was that we'll get an implementation done in South Africa first, and then bring it to India. So we established in these two countries, and then it's a global health tech platform.
Sure.
And as our tagline is that we want to, it's to promote personalized, prospective, and preventative healthcare as a social good, which means we would want to reach to as many people as possible on the planet, and that's what we are up to. Yeah.
So let's get down to basics on how the platform actually works.
Yeah. So there are many parts to that. So I'll see how much we can cover.
Okay.
And the fundamental aspect that needs to be understood in this is that it's a combination of medical science, which is established medical science, and evolving data science and AI. And we are using these words very, very cautiously because not everything with the AI can be solved. We all know that. Specifically in a healthcare, because this is a sector wherein these applications do come very late in the cycle because it requires much more sophistication, maturity, because we're dealing with the people life.
Yes.
So given the stage where we are in terms of the maturity of the technologies like your machine learning, data science, artificial intelligence, some of these can be used interchangeably. So the point is that to what extent shall we use that? And should our approach be is that we become we make use of a technology and bring in a medical science into that? Is that a right approach? Or we maintain the core, which is established medical science, and then we bring in the technology depending on a disease to whatever extent it is needed for it to become meaningful. When I say meaningful, from a large scale impact perspective, because certain of these technologies, fancy technologies, are meaningful, but meaningful for a very small segment of the country, which do not represent as a nation. So those were the thinkings behind that, and everything has been built on top of that. And so somewhere we have used the advanced features like your machine learning based predictive modeling, and somewhere we have used very, very common aspects of your data science from a data analytics and data insights, wherein those things do not exist in a context, and that becomes a starting point. But the approach remains is that you start from there and you pick up in a manner that eventually you will lead up to the high-end technology. So that's the approach that we have followed. And coming to the point of how do people use that? So one of the stakeholder of the platform from a usage perspective is an individual. And let's talk about individual first. So we know that the personalized risk assessments or personalized screenings, be it a breast cancer, be it a cervical cancer, be it mental health, be it a gender-based violence, be it a sexual health. So these kind of a program. So we have built very, very specific modules on this, wherein the individuals can get onto the platform and can go through those assessments. And most of these assessments are attached with the rewards. And these are constructed in a manner wherein we have seen the examples of that, like how these things have been have motivated individuals from an uptake perspective. Because we usually hear this point is that yes, technology can be good, but how is the uptake and how do people adopt that? So we had to think hard from that angle, and we have created enough elements into this which will excite people from a usage perspective.
So do you need to have internet connection?
Yes. So we do need to have internet connection. So that is one scenario. And so the user journey comes is that you can do the self-assessments, and then after that, if the system picks up that you should be connected to care,
Yes.
then there is a referral path to connect to the care. And so that's more from your early detection and a prevention and connecting to care perspective. So that's a one scenario. And you mentioned about the internet. So there I can pick up a second scenario, which we were talking just before the break on the breast cancer. So that is the scenario which is NGO driven as well. So now in this case, the healthcare workers from the Breast Health Foundation team, so they are covering certain regions wherein they have the devices with the internet, and wherein they can go to the clinics and the surrounding area and can do these profiling and these assessments on behalf of the users. So the user's phone number will still be involved, rewards elements will still be involved, which will all belong to the user, the individual, but will be facilitated by the healthcare worker, and there are precise reasons for that.
So it's almost like opening a file at the clinic or at your doctor, and this then sits on the Phylaxis.ai platform or in the cloud or however it works, and then because of what's happened on that face-to-face contact, in our cancer example, then the referrals can start to happen, the information can start being sent to them, and things of that nature.
Correct.
Okay.
Yeah. So I'll just clarify here. So we're not maintaining a patient file.
Okay.
Okay. So, but we do the patient profile on a particular disease.
Okay.
Okay.
So it's a profile on that particular thing that they've been tested for or have done
Or
a
screened for.
self-assessment
Yeah,
for.
correct.
Got you.
Correct. And because that's always the starting point.
Yeah.
And that's where I was referring the example of, say, promoting a breast cancer awareness for the purpose of early detection and prevention. Because literacy plays a role in seeking care.
Yes.
And now the certain examples of that assessment are, there are questions around it like, why do people don't seek care?
Yes.
So is it like they are not aware of that this is happening, or they're not aware of what are the signs and symptoms, what are the risks for that, or are they too embarrassed to go and see doctor? Are there no facilities available?
Yes.
So these kind of examples are there.
So that solves your inadequate access, your limited resources, and the
Correct.
inequality in the quality of service. Can you grab your headphones if you can? As we do have a caller who'd like to engage with you. Thabo, welcome to Power Lunch. Hi, Thabo. Talk to me, Thabo. Hello.
Hello, how are you?
Very
Sorry.
well, thank you. Lovkesh
good.
is
You
here.
know-
Go ahead with your question.
Yes, I have a question. Pabi, I just want to know how long does it take to create a data scientist, you know? Or do we have data as to how many dentists do we have in the country? Because of Pabi, the president once said that he wanted to create 1 million data scientists. And that is one of the most critical skills that we don't have in the country, but because of it will be able to solve a lot of problems that we have. So does your guest there know, because of, you know, I love IT with all my heart, and then I just want to know which route I should take, and then because of that's one of the skills that is scarce at NetBank is needed.
Absolutely
so how long
understood.
does it take to get a data scientist?
Yes, thank you, Thabo. Thabo there in Mamelodi. So the question's about how many data scientists we have in our country, and then what are the steps to become a data scientist?
Yeah, no, I think that's the starting point of Phylaxis.ai,
Yeah.
and that this story resonates with us, and it's a very, very
You can take your
appropriate.
headphones off. It's okay.
This is a very, very appropriate question, Thabo.
Yeah.
So I'll tell you, like 3.5 years back, when we were thinking of we want to get into this direction, the first thing I went ahead and on a LinkedIn search for is there a healthcare professional who is a data scientist as well? And I found 2 people in South Africa. And the reason for me searching for that is because if a person from a healthcare background and has a data science understanding as well, that person with that one brain will be much more effective and impactful in terms of innovation. And that's where the point comes. Is so when I picked up both, and both of them are working with me as of now. And that's one of the fundamental reason you see that a lot of various different aspects have come into the platform, because one is that they from a medical science background, second is a data science, and third, they're local.
Yes.
So these are the three things which are important for having a innovation which is relevant and can be implemented at scale. So now coming back to Thabo's question, so we also tried finding a way that how do we produce more such people in the country so that it scales up.
Yeah.
And so we had couple of conversations with the universities wherein these programs are happening, and so they do take care of these streams as a educational content and bringing it to that level wherein we understand that. But I think the key part that comes is that how do you bring that brain who has understood the data science from a perspective of that you want to innovate.
Yeah.
And innovate for a purpose. And so there are two aspects, research and innovation. Yes, so research should translate into that, and innovation should get to the implementation. And that's where we having these conversations with the universities, wherein we as a private sector, when we can collaborate with them, wherein we can bring that stream of, say, healthcare workers or the doctors or any other health stream. So there are special programs created in the universities of the data science, and then you have a health data scientist coming out of this, and then collaborating with us on a real world programs, and that's we are leveraging that skill from a research and getting into the innovation, and then the platform brings it to the implementation into the world. So that is how I would answer Thabo.
So that seems like it's still underway to build those various streams. But someone like Thabo, who loves IT, who comes from perhaps a data or a innovation or technology background, what can he start with?
Yeah, so the universities have a programs on that. So I would suggest to check on those. So we have discussed with many universities. There are programs available.
There are programs.
Yeah, there are programs available. Yeah.
It sounded as if they were still being developed. But there you go, Thabo. The opportunities are right there in front of you to be a data scientist, if that is what you wish to be. You can give us a call on 0861 987 000 with any of your other questions and comments for Lovkesh, who's in studio with us. All right, so let's talk a little bit how you see AI and telemedicine impacting healthcare. I mean, is this really going to make the large impact in these areas that have limited traditional medical facilities as we imagine it will be?
Yeah, definitely. And that's where technology can play a role. Yeah. And see, I often use a word, if someone asks me, like, what is Phylaxis? So we're trying to scale an impact of a doctor. And that's exactly was the conversation with these health data scientists 3.5 years back is like, what do we do? So how do we scale the impact of a healthcare professional? And that's where the technology plays a role. I think that challenge that remains is how do you make it accessible, acceptable, and affordable and sustainable? So these are the challenges that needs to be addressed in any technology adoption that we're looking at.
You've spoken twice about acceptable.
Correct.
Can you explain what you mean by that in this context?
So, which is a cultural context. To give you an example of so might be regional languages. Okay, so one is a regional language is a good example of that. And second is like certain terminologies may not be acceptable in a certain geographies or certain sections. So you need to be mindful of that because X means Y in a certain region. So that's what it means to be.
Right.
And that's important because we're not only looking at adoption or uptake in a urban area. So you have to think wide.
Yes.
And so there are many aspects of that. So that's where it becomes important to think on these aspects as like, is your platform, is your technology, is your service catering for a multi-language, multicultural, That's where the acceptability comes in.
I understand.
Yeah.
So this is something that will be available or is available across the country, urban area or the far swung areas in our country.
Yeah.
Okay.
So platform is a factor to be in a multi languages.
Yes.
And so this breast cancer awareness assessment is also available in multiple languages. And then the way it is constructed is that if we have to, so the program which we're running in India has a different context to what is running in South Africa, as an example. So that caters to the local aspects of the region over there. So that's where the role of a platform comes in.
Yes.
So it's wherein you have these kind of flexibilities, which makes it much more
individualized, I
yeah.
imagine, or
Yeah.
locally contextualized.
Yeah.
Tell me, a platform is an app, or a platform is a site, or what is a platform?
So platform can have an app, platform can have a site.
But yours?
So as of now, we have only one channel, which is a web channel.
Okay.
But this will evolve into a WhatsApp channel as well, because that's also one of the preferred channel and can penetrate more into the communities. And when I use the term platform, so wherein many different technologies and modules and services can come together for a particular workflow. That's where the term platform comes in.
Okay.
Yeah.
Let's talk about the mission. I think you've mentioned it a few times, to advocate for preventative healthcare and choosing, the different partners that you have for ambassadorship as Phylaxis.ai.
Yeah. So very recently, we had our first brand ambassador collaboration. So that was there in the news as well, Carmen Boucher. So got an opportunity to meet her late last year. She's an health enthusiast, and she's a social person. And so I know one of the mentor of mine for last couple of years. So that's where the connect comes in with Carmen, and collectively we had a discussion on this. And so this came out to be as like, yes, that's something that naturally comes in her as a person.
Yes.
And the agenda of promoting preventative healthcare as a social good, which requires it's a fundamentally different level of thinking, is that in terms of like how would you reach to that many people, and how will you be able to impact on the behavioral aspect. So that requires collaboration with your influencers, brand ambassadors who can make difference in the society and who has that the reach to make it happen. So that's where that brand ambassador collaboration comes in.
And the relationship, right, to be able to kind of draw people into understanding more about how Phylaxis would work. So I imagine this then, if the aim is to scale the impact of a doctor. So, this is something that kind of any healthcare provider could tap into the platform, because we don't necessarily have a doctor at every healthcare facility, unfortunately, for 24 hours in a day. Yeah.
So I can give you two examples on this just to start resonating on this.
Yes.
And there's one element comes in. So we have opened a space for the innovators as well to collaborate with us and contribute to the mission that we are on, which precisely means the person like Thabo, when they get to that level wherein they understand that and they start building, working on a particular project.
Yes.
And suppose they come up with a good model on a particular disease. Now the challenge after that comes is, where do you go and deploy that?
Exactly.
And that itself is a fundamental challenge which we went through. So we found a solution for ourselves. Then we thought it should be done in a manner so that the solution can be offered to other innovators as well to promote the implementation of the innovation. Because most of the innovations, they do die just before the implementation.
Right.
So, so even if it's a small corporate or as an individual, if they build something, then the way it is stitched is that it's a plug and play with us, and then once it comes onto the platform, then you get access to the entire market, the reach, and the principles that we have that all come together. And one such example of that is that we did one collaboration in India. It's on the child development and autism. So that's a small corporation who have been specifically working on this for last 4 years. They have built some models onto that. And so now we will be bringing those onto the platform in India from that perspective. So that's one live example for that.
And that's a great example. It helps us understand further. What are your long-term vision? What is your long-term vision for improving healthcare access in vulnerable communities through your platform?
Yeah, so I think the term that we use as part of our vision as a social good, so that describes everything, that concludes everything in terms of that you want to reach to as many people as possible. And so we have created various mechanisms of that because we understand that alone we will not be able to reach everyone directly. And that is where you heard an example of collaborating with NGO and we collecting the data, and we have mentioned it on our website is that we will make that data available in an aggregated manner for the government as well for decision making. Then we spoken about a model of innovators, how they can come and collaborate into this journey.
Yes.
And we spoken about examples of the corporates as well, the CSI and CSR funding. And that's so the corporates who are not in healthcare, but they still want to support a cause at a national level.
Yeah.
So the banks and the retailers and the telecom sector, so they can put their money onto something which is much more meaningful and large scale. And fundamentally, we have designed this as a very low cost, which means you can do more and less.
Absolutely.
And that had to be thought through from a day one. And one last element in this, which I often say, is that it's a platform for social impact marketing as well.
Okay.
And so the corporates can leverage this.
Understood.
Which is a win-win-win-win proposition for everyone.
Absolutely.
So no one loses in that.
We've hit 3 o'clock, Lovkesh. So how can we find the platform? How do we find you?
It's Phylaxis.ai, Phylaxis.ai. That's it.
Nice and easy.
Yeah.
Thank you very much for this very enlightening conversation.
You've been listening to a Power 98.7 podcast. For more podcasts, visit power987.co.za or subscribe wherever you get your podcasts.